Hello, good evening. Samantha, good evening. You're welcome.
Hello, Professor Ratimi. Lovely to see you.
Lovely to see you. Thanks for being our guest today. Miss Samantha Tross will be sharing her experience with us. So you're welcome to the program. Together
Thank you
we
so much.
on behalf of the BAME Health Collaborative, we do welcome you. Could you please tell us about yourself?
Okay, thank you, Professor Ratimi. I'm delighted to be here. As you know, I'm a consultant orthopedic surgeon specializing in treating conditions of the hip and knee. And for viewers who do not know what an orthopedic surgeon does, well, we look after conditions affecting the bones and joints and structures that attach or pass nearby. So we deal with muscles, ligaments, tendons, and occasionally the nerve. So in my hospital, in my department, I'm the lead for the department. And apart from my clinical work, I am the educational supervisor overseeing the training of the junior surgeons. I'm an examiner for Imperial College Medical School examinations and recently appointed external examiner for the University of the West Indies in Trinidad. And when I became a consultant in 2005, I became the first Black woman to become an orthopedic consultant in this country. I scored another first in 2018, being the first woman in Europe to perform robotic hip surgery. So very, very proud of those two achievements.
Well, no, these are very great achievements, and I must commend you for that.
Thank
The
you.
question is this. I mean, there are many specialties in medicine, dermatology, neurology. Why did you decide to become a surgeon, and more so
Well,
an orthopedic one?
sure. Look, apparently at age 7, I made a declaration at home that I was going to become a surgeon. I don't think I really understood what that entailed, but from the age of 7, I was working towards getting into medical school. And once I got into medical school, I became enthusiastic with many of the subspecialties. But orthopedics, well, surgery caught my attention, primarily because it's something I'd always said I was going to do, but I was very, very good at anatomy. I loved anatomy. And so I decided, look, I think surgery is for me. Orthopedics I chose because the orthopedic surgeons were really the friendliest of all the surgical specialties that I'd rotated through. I spent time in plastic surgery, neurosurgery, that's dealing with the brain, vascular surgery, the blood vessels, general surgery, as well as orthopedics. And the orthopedic surgeons made me feel welcomed. Sometimes as a student, you can feel like a spare part. Then the first female surgeon I ever saw was an orthopedic surgeon, and of course that impressed me significantly. And then orthopedics itself is a very varied specialty. You can treat young and old, male and female. You've got all the different subspecialties. You can be a hand surgeon, hip and knee like myself. You can do spinal surgeon, pediatric, young children. So really, there's something there for everyone. And the
Wow.
patients are generally well with an injured body part, so they get better very quickly. And I realize that I'm someone that's not very keen on chronicity. And the last thing is that unless you're working in a trauma center, most orthopedic surgery can be done in daylight hours. And for someone who was considering having a family, that was also an important consideration. So for all those reasons, I chose orthopedics, and I have no regrets at all.
Well, I can see that or hear that in your voice that you really, really enjoy what you are doing, and congratulations on those achievements. Now,
Thank you.
when we talk about the Black and Asian and minority ethnic groups, for example, you may remember that people say Black people cannot swim because they've got heavy bones. Uh, do you see any differential in terms of bone issues between the different racial groups? Are we
Uh,
prone to osteoporosis, or can't we swim? Why don't we see black swimmers? What's in it? What's in our bones? Is it different?
All right. Well, lots in that question there. Um, Certainly, the morphology, the shape of the bones does vary between different ethnicities. Certainly, there's a difference between men and women as well. And in African Caribbeans, they tend to have a quite thick cortical bone. So that's one thing. In terms of the conditions that the BAME community have, there are a number of reasons that the BAME people are more affected by certain conditions. For instance, knee arthritis is more common in the BAME community. A condition called slip upper femoral epiphysis, where the growth plate around the femur moves and causes a subsequent deformity of the hip. That's more common. And then conditions where there is a damage to the blood supply. So in Black people, there's a higher risk of sickle cell disease. And if the blood supply to the bone is impaired, then you can have conditions subsequent to that. So for those things, so there's some genetic predispositions. Then there's socioeconomic ones. I mean, in terms of the careers that the BAME community may take up. And then there are cultural reasons. You know, for instance, in the Asian community, there's a lot of kneeling and praying, so that may have an effect on why they have more knee arthritis. So there are lots of different factors that have an impact.
Well, that is good. You are an ambassador for the BAME Health Collaborative, and I'm sure you've noticed that there's quite a large support from different ethnic groups, different racial groups. Why do you think that is so? I mean, we've got Chinese, we've got English people, people of all shades of color. Why do you think they've come forward to support this initiative?
Well, I mean, BAME actually is Black, Asian, and minority ethnic, so we're covering the health impacts to all of these communities. So therefore, I'm not surprised that they're interested. I think people are more in tune now and more aware of the inequalities in health. I think that became really to the fore with the COVID crisis, when we saw a lot of people of Black and ethnic minority dying predominantly more than our Caucasian colleagues. And so, you know, people were then alerted to the fact that there may be an inequality. And I think there's just a certain level of consciousness now that people want to know about their health, which is only right. And to try and find the ways that they can best improve it. So it's welcome, and I'm very pleased that they're all getting involved. And then there are, of course, non-BAME people involved as well. Because again, this issue of inequalities in health, they were also made aware of that. And it's great that we have allies and people who want to come and assist us.
Why have you chosen to become involved in this?
Well, I mean, when I was I was approached by one of our ambassadors, Daniel Taylor, who basically said to me, "I need you involved in this, and you have no choice. You can't say no." But I must confess, I didn't actually need much persuasion. Being in healthcare, I am only too aware of the predominance of certain conditions within the BAME community. For instance, as being a hip and knee surgeon, I see a lot more. I'm based in Ealing, in the Ealing area, and it has a very high Asian population. And the majority of, although it has a high Asian population, the European population is greater. And yet, when I'm dealing with patients with knee arthritis, they're predominantly Asian. So that was something I was noticing. And also, the outcome from surgery was not as good. And I needed to understand why that was. So I was already starting to take an interest in some of these differences that I was seeing in different groups. And so what I'm aware of is that there's very little data from the UK. The information that we've got regarding inequalities within the orthopedic arena are all coming from the US, or they're studies from China and Singapore. with regards to the Asian population, but not here. And whilst we can extrapolate from the findings, there may be some environmental impacts. So we need to really collect our own data. And so I was very keen to get involved because I hope that that will be part of what we do is data collection, and not just collecting the data, but the way the data is interpreted. And it's important that we're there and have an input so that we can really have a broad view of the data and the conclusions therefrom.
Right, thank you for that. Now, the collaborative is not just about the patients you serve, but it's also about people, professionals, healthcare professionals who work in hospitals and in social care. What would you say is your experience as a person of color or any of your colleagues within the health sector?
Well, there is no doubt. Now, I'm part of the BAME network here at my hospital. And so I get a view from the nursing staff predominantly who are in that group. Now, in my actual department, I am the only woman in the department. This is out of 26 consultants. I'm the only Black person. But as you see, I've obviously made it well. I'm here. I'm a consultant, and I'm the lead in my department. But there's no doubt that on the way there were certain things that I experienced, and I hear from others coming through. This is from other trainees who reach out to me, and also from nurses. There's an awful lot of bullying, and when the hospital does this survey, predominantly BAME people who complain of bullying and harassment. So there's that, and you find when you look in the hospital that in positions in senior management positions, there is a paucity of people of BAME background. So there may be some cultural differences and cultural misinterpretations, which may lead to people feeling bullied or harassed. The feeling of not getting opportunities to progress, and certainly when you have any investigation, the outcome of the investigation tends to be more severe. And I've been on the receiving end of something like that. So these are things that we need to look at and we need to address, because it affects your ability to do your work. You tend to have a high turnover of staff when the NHS really could not afford to lose manpower. So there's going to be a high turnover. There's going to be time off work because of mental illness, etc. So really, we need to focus on getting this right.
All right. Well, thank you for that. I think one good thing is that the government and society are now standing up against bullying in the workplace, bullying at home, violence against women. So this is an opportune time. And I think going forward, how can we as people of color and ethnic minorities navigate the system to get over this bullying, or to get our colleagues to see from our own point of view? Because, it is possible that at times when people bully, how can you influence them so that they can empathize, they can understand and change behavior?
Well, I think Professor Rotimi, I think I got a gist of your question. I lost a little bit there, but we need to have more people of BAME backgrounds in positions of authority. That's the first thing, because really and truly, it's the senior people in the organization that can influence the behavior of the people within it. So that's one thing we need to do. We need to make the staff feel that they have an equal chance of progressing. And you can't be what you can't see. So I think that's one thing. We have a lot of this diversity and inclusion training, and that's to be encouraged. And also we need to look at who's delivering these workshops. It's quite interesting because the College of Surgeons, the person doing a lot of the diversity teaching is actually someone who's Caucasian. So I think things like that really need to be addressed. And then we need to have a culture, and this has to come from the top, where people feel able to articulate their frustrations, and are not with a worry that they're going to be judged adversely. So it's the environment has to be right, and that has to come from the leadership.
Thank you. The current pandemic, COVID-19, has exposed a lot of disparity in healthcare. What are your views? How can we strengthen? I'll give you an example. For example, as people of color, at times we don't present early. Is that an issue?
We don't. Sorry, I didn't hear that.
We don't present early.
Right. Yes.
Yeah. Access.
So, yeah. Mm-hmm.
Yeah. Do you want to
But
comment?
when I'm asked about, like, for instance, coming back to knee, I keep talking about hips and knees because that's what I do. But patients with knee arthritis. So I mentioned that I noticed that there was a difference. So not only was I seeing more knee arthritis in the Asian population, but the outcomes were worse. And I wasn't sure whether they were actually worse, or is it the fact that the expectation was different. One thing I do know is that they do tend to present later in the disease spectrum. So there's a reticence to seek medical advice. And by the time they've come, there's so much deformity. And the best predictors of postoperative function is preoperative function. So if you come late when the knee is already stiff, it's going to be stiff afterwards. The joint replacement is just going to take away the pain. There may be some improvement of movement, but it's never going to be as great. So we have to educate the community so they do present earlier. That's one thing. Second of all, you've got to have more BAME staff, because patients are more likely to take up advice from someone they can relate to. So that's another reason why they may be reluctant to proceed with surgery. And then, but once they've had the surgery, before they go to surgery, they need to be adequately counseled to know what to expect from the knee replacement. And then once we've done the knee replacement, and I'm saying knee replacement, but any condition, you can use this broadly, you have to use the right outcome measures to pick up what it is you're looking at. And some of these forms, a lot of the questionnaires we give out, are not in different languages, for instance. So there could be misinterpretation when they're listening, when they're reading the questionnaire, and maybe the questionnaire is not fit for the purpose in which it's designed. So there are lots of different areas that we need to look at that can have an impact. And then, of course, access as well. You touched on that. Often the services tend to be in more affluent areas. So we need to be able to have the services where patients can actually access them. So all of these things can impact.
No, thank you for that. I'm delighted you mentioned the word education, educating the public to seek medical care early. And I believe that is one of the things that the BAME Health Collaborative will be working strongly on. Now, the Parliament has invited the BAME Health Collaborative to come and share its ideas or its vision with them. What do you think about this? And how can we use that opportunity to influence decision-making in the Parliament?
Well, I think it's excellent. And really, as the BAME Collaborative, we have to decide on which areas we want to focus on. And this is an opportunity to get parliamentary support to drive those initiatives forward. For myself, what I'd like us to look at is inequalities in the workplace with better working conditions. I would like to see better data collection. We need the data. And then once we've got the data, then we can certainly assist with interpretation of the data. We can be there to assist with writing policies, or giving our input or writing the policies. And then another area I would really like us to focus on is obesity, because obesity has far-reaching consequences. It can affect the patient's well-being, their mental well-being, the cardiovascular status. Obesity is linked to cancers, and certainly obesity is linked to joint arthritis. So that, just focusing on that one area and targeting that, can have far-reaching impacts. And I think this is a great opportunity for us to really highlight the areas that we really want to focus on so that we can get the support that we need.
Right. Now we live in a multicultural society now, and we have a lot of interracial marriages taking place. And I believe there'll come a time when the color of your skin doesn't determine who you are anymore, because you could be white and have the sickle cell trait. So what do you think this new millennial bring to society? Because they have a different view of life than our grandparents and parents. Do you think that the new millennial will be able to change the narrative?
I mean, I certainly hope so. I think evidence suggests that it will. I mean, when I look at the young people, there's a lot more integration taking place, which is good. So they're having the conversation, and that can only make things better in many areas. The working environment, particularly, as more integration occurs, then again, people will feel that they can also achieve different goals in the workplace. In terms of the health impacts, I can't think of there's going to be any necessarily positive impacts in terms of disease. Certain genes, mixing of the genes may prevent certain diseases and so on. I don't have that information to hand, but I am encouraged when I see the young people. I mean, I was so encouraged with the George Floyd thing and seeing the multi-ethnic and multiracial support that was given there. So there's more of a sense of community, I think, with the young. They are our future, and looking at the way that they're behaving, the future is certainly looking brighter.
Right. Now I'm going to take you back to your specialty, orthopedics, bones, about bones. We are living longer. What are the five? It doesn't have to be five. The priorities you will tell us. How do we protect our bones right from youth? We are living longer, and it's a burden on the NHS.
Yeah. Well, I mean, it's basic things. Having a balanced diet, that's important. Certain nutrients are required for the body's normal processes, repair and healing. So a balanced diet, I would say, is important. Adequate exercise. Not only does it keep the muscles nicely toned, and the muscles help support and stabilize the joints, but also if you don't have enough, too much excess weight, then that's less stress to the joint. So that's the benefit of having a good diet. So diet and exercise, those two are very important. And when you're doing exercise, you've got to make sure that you're doing the exercise appropriately. And pay attention to things like the right footwear, etc. So it's not just go to the gym and I'm going to start doing exercise. Make sure that you're properly instructed how to use the equipment safely. And then, as the education part about presenting when you do have symptoms, seeking advice early. We still, although I'm a surgeon, I still believe in conservative treatment, and is always try to go with a non-surgical way of approaching things. And by getting early advice, you may prevent having to have surgical intervention. So those really are the key things, I would say, with regards to looking after your joints.
Lovely, that's helpful, and I'm sure people will take that on board. Now, the handle of the BAME Health Collaborative is Together We Can. you made reference to the Black Lives Matter, and at times you hear people say, "But what about the white? Does that mean white lives don't matter?" What would you say about that? I know some people say all lives matter. Are we? What are your views about that hashtag?
Look, nobody has ever said that white lives don't matter. Of course, all lives matter. But we're just trying to highlight that there are certain things that the Black community are disproportionately disadvantaged with. And we're just trying to bring the spotlight on that. But all lives do matter. And of course, so do white lives. But please, let's not take away the emphasis from the issues that we're raising, because they've been going on for far too long. And really, the time is now for positive action. So, that's what I say.
Yeah, I'm happy you said so, because from the health indices, we know that social determinants do affect health. Where you live, what you eat, does affect one's health. And that's why, and I'm happy you said it's not to the exclusion of our white
Mm,
counterparts, but that we want to redress or readdress the
mm.
disparity in society. All lives matter, Black lives matters, and white lives matter. And I think the narrative is, yes, let's try and improve the health of the Black and Asian community, the minority community in this country and worldwide. Um, Now, I'm sure there will be some young female or male people aspiring maybe to be surgeons. What would you tell them in terms of you being a role model, for example? Is it something they can do? Or is it an easy walk through the park?
Well, look, if you're passionate about it, then it does seem easy. Of course, anything you do, any career that you go in requires hard work. But I think that you've got to really know yourself, and therefore, once you do that, you will choose something that's appropriate for you. And I chose something that I'm passionate about, so it doesn't feel like work. Um, I think you've got to, for the young people out there, if it is really a desire of yours, you've got to investigate what is required. The A levels, you've got to have a minimum of 3. You've got to have chemistry in particular. You've got to show some interest in the career by doing some work experience, perhaps, whether it's in the hospital or with the allied services like the paramedical service, etc. But you got to show some interest, and also you got to be able to stand out from the crowd. So it's not just about focusing on your medical things. Show that you're a well-rounded individual, something that can demonstrate your leadership skills, for instance. It does take work. It takes a lot of perseverance, but it's a very worthwhile career. And as I mentioned before, within orthopedics, there's so many subspecialties, and there really is something there for everyone. And so if you are interested, try and get to one of your local hospitals, see if you can have a student attachment, just to get a little bit more insight in what is involved. But we definitely need more women and more ethnic minorities into the specialty.
Yeah.
So well.
I want to thank you. You've thrown quite a lot of light on what the BAME Health Collaborative is trying to achieve in terms of addressing the inequalities and equity in society. What would be your take-home message for viewers? What would you tell them about BAME Health Collaborative? I'm sure
Get
you.
involved. Yes, I seen the time's up. I would say get involved, come on board. We need your support.
That's good.
Thank you.
And you, as an ambassador, you're doing a good job, I understand.
Thank you. Thank you very much.
Yes. And well, it's been a pleasure talking to you. Thank you for coming on to the show, and thank you for throwing light on the bone issue. And you are an inspirational lady, being the very first Black lady in orthopedic surgeon. It is an achievement, and I want to congratulate you for that. And I'm sure there will be people watching saying, yes, one day I want to be like her. Samantha, uh, really want to say thank you to you for coming on to the show. We hope when next we call upon you, that you will be willing to come and share your thoughts with us.
Anytime. Thank you.
Lovely.
And thank you,
Thank you.
TV3. Thank you.